Hi, hello everybody. This is Dr. Ghousia, pediatric dentist associated with HOSMAT Hospital Hennur branch, and I am in charge of the operational systems in the dental unit here, along with my team and co-consultants. So here I am today in making you all aware about the sports-related injuries or dealing with the sports dentistry. So most often we know that children are very fond of playing. Nowadays, with outdoor games in action after the post-pandemic and the contact sports, most of the injuries are related to the face, which is the most vulnerable area of our body, and in particular the T-zone of our face, which is least protected. That is the zygoma, the nose and the mandible. So it's our duty as the healthcare providers to educate you all and make aware that these injuries can be prevented. So first thing first, when the injuries happen or any trauma occurs on the playground or at home, first thing is to keep calm, compose yourself, and then call your nearby dentist or the maxillofacial surgeon. So as soon as the tooth is being knocked out, so we would ask you all to call up a dentist for the emergency appointment and ask the tooth to be, I would request the patients to hold the tooth on the ground position and not touch the root. So the root will have viable size as well as the membranes, and this tooth within 45 to 90 minutes till your reach dentist is viable and can be reimplanted into the socket. So that's the time priority is very important. The golden hour, what we call, is 45 minutes to 90 minutes if you can reach the dentist. Now how do we, in case this is solid or fallen into the ground, all you have to do is go with a gentle tap water open, not with the forceful water, because we don't want the viable cells, the living cells and the tooth to be lost, the membrane to be lost. Gentle taps of water to remove the debris and carry it, keep the whole tooth moist. That is, it has to be soaked into the saline, that is salt water, or milk or patient's own saliva. So this has to be instructed to the caretakers, to the sports teacher or the physical trainer, as well as the teachers who are taking care of the children, and the container has to be locked so that the tooth is not lost and we have to reach the dentist. Meanwhile, any soft tissue injuries can be taken care by washing off the wounds and approaching the dentist as well. Now, how do we prevent these knocked out tooth from happening? So one thing is, if you go for seasonal examinations to your nearby dentist for the tooth, now how are children prone to dental injuries or the facial trauma is one thing is when the upper front teeth is more protruded. So the dentist will be able to be the best judge to find out if these teeth are vulnerable to injuries. So they will need braces or orthodontic correction so that the injuries are prevented. Another thing is, when the game is on, it is must to have mouth guard inside your mouth. Be it contact sport, cricket, cycling. So all these sports need mouth guard prevention. Now mouth guard is customized, which will be taken in patient's mouth, which is most of the mouth guards are available commercially in a lot of websites, but I would advise not to go for it because it will be ill-fitting. So customized to your child or the adult who is undergoing sports or playing games should be taken by the dentist. The impressions are taken, fabricated by the good material from the lab and over-checked. So each time any tooth is knocked out, any injury happens, there is absorption of those injuries with the mouth guard, and the temporomandibular joint, your joint, is protected. This joint, which helps in opening, closing and movement, will be protected by the mouth guard which you are wearing in the mouth, because it absorbs the injuries, the impact injuries which happens on your chin or below on your face, so that the teeth are not broken. Now these sharp edges of the teeth itself can become injurious to your own soft tissues. So all this can be prevented if you visit your regular dentist, educate yourself on sports dentistry, and let's help our little athletes to become successful champions of tomorrow. Let's help them in performing knocking out sports rather than having broken or knocked out teeth. Thank you.